Hello, my name is Dr. Netta Elbuluk, and I'm a board-certified dermatologist specializing in pigmentary disorders and skin of color. I'm the founding director of the USC Skin of Color and Pigmentary Disorders program and professor of clinical dermatology at the USC Keck School of Medicine. In my clinical practice, I often treat patients with vitiligo, a chronic autoimmune condition. In vitiligo, a loss of functional pigment-producing cells called melanocytes results in depigmented patches of the skin. There are various tools available to assess disease severity in vitiligo, including but not limited to measures of disease activity, like the Vitiligo Disease Activity Score and Vitiligo Signs of Activity Score, as well as measures of disease extent, such as the Vitiligo European Task Force Assessment, the Vitiligo Extent Score, and the Vitiligo Area Scoring Index, or V-VASI. V-VASI is a clinician-reported quantitative tool. We discussed the Total Vitiligo Area Scoring Index, or T-VASI, in a previous video. The Facial Vitiligo Area Scoring Index, or F-VASI, will be the focus of this video. F-VASI applies the same principles as its parent tool, T-VASI. While T-VASI assesses disease extent across the entire body, F-VASI is focused only on the face. F-VASI is commonly used in clinical trials, so understanding the scoring is key when interpreting trial results that report facial repigmentation as a treatment outcome. Now, F-VASI is a clinician-reported outcome measure used to assess the extent and severity of vitiligo on the face, using a standardized method designed specifically for the facial region. Vitiligo lesions are measured using a fingertip unit, or FTU. So 1 FTU is equivalent to the distance from the tip of the patient's finger to the first joint, and it's approximately equal to 0.03% of the total body surface area, or just under 1% of the face. Using the patient's finger ensures this ratio is maintained even in our pediatric populations. The degree of depigmentation within the affected area is estimated using standardized categories of 0%, meaning no depigmentation, 10, 25, 50, 75, 90, or 100%, meaning complete loss of pigment. The total F-VASI score is calculated by multiplying the BSA percent involved by the degree of depigmentation. So F-VASI scores can range from 0 to 3, as the face is approximately 3% of the total BSA, and a higher score indicates more extensive and complete depigmentation. F-VASI has been used in clinical trials to evaluate treatment efficacy on the face, which is oftentimes cited as a primary area of concern for patients. In clinical trials, outcomes are often reported as proportions of patients achieving certain percentage improvements from baseline, such as F-VASI 50, F-VASI 75, and F-VASI 90, indicating a reduction from baseline score of at least 50, 75, or 90%, respectively. The definition of clinically meaningful improvement may vary, but recent studies support that a 75% or greater reduction in F-VASI from baseline, or F-VASI 75, is considered clinically meaningful. For example, if a patient has a baseline F-VASI score of 2.4 and then after treatment has a score of 0.6, this would be a 75% improvement, meaning F-VASI 75 was met. F-VASI scoring does require training and is reliable and sensitive in trials. Validation studies have shown an acceptable intra and inter-rater reliability and accuracy of F-VASI as a measurement tool, essential for ensuring consistency across clinical trial sites. So let's walk through an example of how to score an F-VASI with a hypothetical patient. The patient presents with vitiligo affecting an area measuring 40 FTU. As mentioned before, each FTU is about 0.03% of total BSA, so 40 FTU would be 1.2% of the total BSA. The affected area is estimated to be 75% depigmented. So by multiplying the BSA percent, 1.2, by the degree of depigmentation, 75%, the final F-VASI score for this patient is 0.9. In summary, F-VASI provides an objective, comprehensive way to quantify facial vitiligo severity and track treatment response over time. Understanding how F-VASI is calculated is critical as it can be extremely helpful when interpreting clinical trial results. This is especially important as patients have indicated that facial repigmentation is a treatment priority. So, to learn about T-VASI, the parent tool, which is used to assess vitiligo involvement of the whole body, please see our other video in this series.